Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the study. My dear friends, today we shall discuss about role of Shirodhara in neurological disorders. Now, Shirodhara, Shirobasti, actually basically they are practically difficult in the patient of neurological problems in children. So instead of that, best is you can go for Shiro Lepa, Shiro Talam, Shiro Pichu or Shira Tarpana or Tala Patichil or Shiro Abhyanga. That is a modification. This can be even conducted by the patient in the home, okay, on the daily basis. The practically Shirodhara is quite difficult to do in cerebral palsy and other neurological problems due to lack of cooperation, and even in the autism it is very difficult, and even in ADHD it is very difficult. It is because of these behavioral problems and non-cooperation, and also because of the postural problems. You are not able to maintain the particular posture. So Shirodhara works by modulating the brain action. Okay, it actually helps in altering the concentration of the neurotransmitters inside the brain. Studies suggest that. That means suppose if the excitatory neurotransmitters are more releasing, then Shirodhara will go into work by reducing it and increasing the inhibitory neurotransmitters. Okay, in general, totally it decreases the excitability of the neurons. We can often see that. After giving Shirodhara, patient usually going for sleep. The reason is sleep is always a parasympathetic function. Okay, sleep is always induced by the parasympathetic activity. That means that Shirodhara will going to increase the parasympathetic activity. That means Shirodhara will going to increase the sleep. Sleep means it is Shleshma. Nidra Shleshma Tamobhava. That means it increases the Tama quality. Already we have discussed Tama is nothing but inhibitory neurotransmitters. Now these are the pictures. Now what are the drugs which are used for the Shirolepa? Shirolepa can be also applied instead of Shirodhara. The most preferable is Jyotishmati, Balataila, Tunga Drumadi Taila, etc. Shiro Abhyanga, Shirolepa, Shiropichu, everything can be applied. The lepa of the amalaki with the Panchakarma Churna and Balamula Churna is also good. Lepa prepared by different Medya drugs can be also applied. Kshirabala Taila may be used as a medium, or Jyotishmati Taila can be used as medium. Shiro Pathabandhana with the Kalka of the drugs, Medya drugs may be also useful. Drug issue should be those which increase the neurotransmitter, cholinergic neurotransmitter. Parasympathetic activity should be increased. Okay, so parasympathetic activities that increase means you are increasing or you are strengthening the inhibitory neurotransmitters. So once the inhibitory neurotransmitters are get strengthened, excitability of the neurons will be decreased. That's the logic. So cholinergic is related with the rest, digestion and metabolism and elimination, that you know. So we are only taking the rest or sleep, because all the body activities like sleep, digestive activity, metabolic activity and excretory activity, these are actually managed by cholinergic activity. That means parasympathetic nerves. Okay, so therefore to decrease the excitability we are doing this. Suppose you are going for Vamana in children, these are some of the features. Of course, in neurological disorders we are not going for that. Now coming to the role of Basti, which we will going to discuss in the next class. Thank you very much.